Harold S. stopped me in the skywalk in the hospital. "Aren't you that doctor on TV? Can you talk about gout? My foot is killing me." Well, Harold, you're not alone. Gout is characterized by sudden onset of intense joint pain. It often attacks the joint at the base of the big toe, but can affect the foot, ankle, knee, fingers, wrist, or elbow, and can actually affect any joint. The joint usually becomes swollen, warm, red, and extremely tender. Even sheets touching it can be excruciating. Gout is caused by excess uric acid in the blood, and this is also called hyperuricemia. The ionized form of uric acid is called urate and can result in urate crystals forming. Urate crystals can cause acute inflammatory arthritis, those painful swollen joints. Tophi are hard nodules under the skin, and they can form around the joints, possibly causing joint destruction. Gout and high uric acid levels can also damage kidneys and create uric acid kidney stones. Gout is more common in men and is rare in premenopausal women, and the incidence of gout increases with uric acid level. In 90% of cases, hyperuricemia is due to renal underexcretion of urate. Basically, the kidneys are not getting rid of it fast enough, but in 10% of cases, it's due to overproduction of urate. Risk factors for hyperuricemia can sometimes lead to gout and include dietary factors such as consumption of seafood, meat, and alcohol, especially beer. Other risk factors for gout are obesity, insulin resistance, and hypertension or high blood pressure. High cell turnover in certain cancers of the blood or with chemotherapy can sometimes bring on gout, as can drugs like diuretics, also known as water pills. But diuretics are important for some heart problems and are usually used without causing problems. The best test to diagnose gout is arthrocentesis with synovial fluid analysis, which means getting some of the joint fluid with a needle and looking at it under a microscope. Urate crystals will show up under polarized light. The treatment for gout is NSAIDs, or non-steroidal anti-inflammatory drugs, such as naproxen, ibuprofen, or similar medicines. These work as well as indomethacin, which has been one of the standard treatments for years. Colchicine is a medicine that is used for people who can't take NSAIDs due to allergies or a history of gastrointestinal bleeding. This medicine has lots of side effects and can cause diarrhea and nausea. Steroids sometimes get used, and these can be taken by mouth or injected into the joint. But steroids can also have lots of side effects. Long-term management of gout includes dietary modifications, weight loss, and cutting out alcohol. There are medicines to prevent gout flares if they become recurrent, and these can be discussed with your healthcare provider. Remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vainio, and this is Health Matters.